Disclosures for this and all episodes in this series can be found on the podcast series destination page located on education.webmd.com. The following presentation is copyrighted by WebMD Education. No use, broadcast, or recording of this presentation or any part thereof is permitted without the written authorization of WebMD Education. The following podcast is supported by an independent educational grant from Moderna, Inc.
Hi, my name is Dr. Megan Pesch. I'm an assistant professor of developmental and behavioral pediatrics at the University of Michigan. I'm also the director of our congenital CMV developmental follow-up clinic. Welcome to this podcast episode entitled What to Know About Getting Your Baby Tested for CMV. This is part of a 6-episode podcast series called Let's Talk CMV. Today, I'm speaking with Dr. Sally Permar. Dr. Permar and I have known each other for some time through our advocacy work and mutual passion for taking care of patients with congenital CMV. Dr. Permar, Sally, welcome. Can you tell us a little bit about yourself and your work with CMV?
Hi, Dr. Pesch, and thank you for having me on this podcast. I'm the Department Chair of Pediatrics at Weill Cornell Medicine and the Pediatrician in Chief at New York Presbyterian Kamenetsky Children's Hospital. And I'm a pediatric infectious disease physician and a researcher that focuses on prevention and treatment of congenital infections, the most common of which is CMV.
Thank you so much for being here. I know you're so busy. I just wanted to take a step back. A lot of people don't know about CMV or cytomegalovirus. It's a mouthful, so that's why we say CMV. They don't know about CMV in general, but it can be especially important for parents and anyone who may become pregnant. So, just as a reminder for all of us, CMV is a virus, and anyone can get CMV really at any age. It's a super common virus, and many kids will get it before they turn 5. Honestly, most adults get it before they're 40. And yet, most people have never heard of CMV. So, if someone is unfamiliar with CMV, you're definitely not alone. Once someone catches the CMV virus, it actually stays in their body for a lifetime, similar to the virus that causes chickenpox. So, when someone first catches CMV, the virus goes into their cells, but it can be reactivated over time, similar to how the virus that causes chickenpox can reactivate, later on. Sometimes we see this in older people and they can get shingles. The difference with CMV is that most people will never know that they have it. The first time someone catches CMV, that's called a primary infection or a first infection. And most people don't even have any symptoms. Some people might get a little bit of fatigue or like swollen lymph nodes, like a very, very mild cold, but most people will have no symptoms at all. You can then get a reinfection. That's another type of CMV. So you can catch another strain. And then one of the other types of CMV is it can become reactivated. So that means an earlier CMV infection that's been lying dormant in the body becomes active again. Again, most people will never know that that infection has been reactivated. The biggest exception to that, I would say, is, if someone has a weakened immune system, getting a reactivation or any sort of CMV infection can be dangerous. And the other circumstance that it can be really dangerous is if a person is pregnant and that virus is activated in mom, but then passes through the placenta to the baby. And that's what we call congenital CMV. Dr. Permar, I know that was long. Thanks for being patient, but I just thought it'd be good to provide that background information. So, can you tell us a little bit about congenital CMV?
As you said, congenital CMV is one of the cases where CMV can be dangerous. So, as you mentioned, CMV is a very common virus, and most people get it eventually. So, having CMV or getting it during pregnancy is not anyone's fault. There is no blame. One of the reasons that it's so common is that it's easy to spread when CMV is active in someone that you're interacting with closely. It can be easily passed. The way CMV spreads is when you have contact with body fluids of someone who has CMV, such as saliva, tears, urine, vaginal fluid, even semen, as well as breast milk. So, as caregivers of young children, that's one place that you can get that by changing their diapers, cleaning up their drool that's on all their toys, etc., that we know, and they love to share those things with us as well. When adults have a healthy immune system and get CMV for the first time, they won't even know that they've had it typically. They don't feel sick, they have very few symptoms, but often with CMV, there's no symptoms at all. Babies who are born with CMV can have very serious symptoms, however, if they catch it when they're still in the womb. And that has complications that can lead to long term neurologic deficits, including hearing loss. However, even with those babies that get CMV before they're born, there's a range of very few to no symptoms of having that infection, all the way to children that have very serious long term complications. The risk of complications with a pregnancy and the baby is when the mom gets a virus for the first time during pregnancy. You can also spread the virus to the baby when you are reinfected with CMV or even when CMV reactivates. So it's a complicated infection in that it's not only the first time that a pregnant person gets the infection that is the risk for the baby. When the baby is exposed in utero, the virus is able to cross the placenta and can change the way some of the organs are developing, including the brain. And so those babies that are born with congenital CMV, the types of complications that they can have include brain abnormalities, seizures, diseases like cerebral palsy, a small head, intellectual disability, motor disabilities, learning problems, and hearing loss as a very common complication, but up to 3/4 of the kids born with CMV that actually have no complications at all. So, as physicians who see these children, we know that there's a range of complications.
Absolutely. That was such a good summary. And I'm always so blown away at the spectrum. A lot of these kids do really, really well, but I think it's important to always kind of have our guards up to make sure we're not missing anything. And you mentioned that CMV can spread really easily. And I share this in other episodes, but I'll share it again. So I have a daughter with congenital CMV. She's my third daughter. And that's really one of the ways I became interested in this topic. Looking back as a physician, but also as a mom, I can see, how I easily caught it. And actually, I don't know if I caught it for the first time with my pregnancy with my third daughter or if it was previously. I've been around kids and body fluids and they're so drooly and it's
You were
everywhere.
taking care of two babies too.
Yes, it is like my career and my home life. So some common ways that CMV can be passed includes direct physical contact. So when you're sharing body fluids, pregnancy, so that's in the case of I passed it to my daughter, during the birth process, through breast milk, like you mentioned. It can be transmitted through blood transfusions or organ or bone marrow stem cell transplants. But here we're talking about congenital CMV. So that is really where the virus is passed from mom to the baby in utero. It's so interesting because even if the baby catches it during the birth process, the repercussions are so different. It's usually not a big deal at all if a baby catches it, even like as they're being born. It's kind of when they're developing that we get most worried about. Looking back at my potential exposures for CMV over my lifetime, working with children is a risk factor. And that is because young kids, especially those who are in daycare, as all parents know, like to share their germs. They're drooly, they're putting things in their mouths, they're putting their fingers in your mouth, even if you try not to. They share the virus very easily. And even if the child is not actively having symptoms of a CMV infection, they still can have the virus in their saliva or urine for months and months after that first infection. So you really have to have your guard up as a parent or somebody who works with young children. Dr. Permer, can you tell us a little bit about the difference between prenatal and postnatal CMV exposure?
So, as you talked about, it is very different the timing at which you might be exposed to and get the CMV virus. For prenatal exposure, that means a baby is exposed to CMV prior to being born. And that is due to either a maternal infection during pregnancy, a reinfection because they've already had the virus, but it can be caught again, or the virus that lives within their system reactivating. However, as you just described, children, toddlers, especially those in daycare settings, group settings, are constantly sharing their body fluids with others. That's a common time that children spread the virus amongst themselves. That postnatal exposure, or basically being exposed to the virus after you're born, essentially has almost no complications to it. The only complication would be if the child has a very weakened immune system. But this is an important thing for testing because what it means is that there's a very small window of time that we can test for a congenital infection or one that was acquired before birth before it starts getting clouded by the fact that these babies are being exposed to CMV in other ways, like via breastfeeding or via interaction with other children. And so that's why it's so important that if there's a concern for congenital CMV, that the testing is done within the first 3 weeks of life. So that's when we can say with most certainty that the infection started in the womb as opposed to after birth. And those are the types that we do want to know about because they need to be screened for potential problems with learning and hearing, et cetera, as well as potentially go on to treatment that we know can help some of those children. It is also important to differentiate testing in a baby, which is done typically by testing either the urine, the saliva, or potentially the blood in those first 3 weeks of life. Even at your delivery visit before you leave the hospital is really probably the best time. However, a lot of moms want to know when they learn about CMV, well, can I get tested to see if I have had the infection or if I'm at risk of transmitting this infection to my baby who's not yet born? And that is a bit more complicated and less definitive, really, than the baby testing. So, for moms, you can pass the virus to your baby on almost any type of infection. It can be the first time you get the virus during pregnancy, is one of the biggest risks for passing the virus to the baby, but you can also pass the virus when you've had the virus in the past and it's living in your body, or you're reinfected with another strain of CMV. So testing in moms for just do you have the virus or not doesn't give you all the information as to whether you're truly at risk of transmitting the virus or not. So if we did an antibody test, which is a marker of you've had the infection in the past, and you test negative, then we can say you've never had the virus, therefore it's not living in your body. But if you test positive for the CMV antibodies, then it only tells us that yes, you've had the virus in the past. You may or may not pass the virus to your baby. But the other thing that an antibody test can tell us is whether it's a recent infection or not. And that is by testing something called the IgM antibodies, which is an early antibody response. If it's still elevated, that means you may have been infected recently. So it's worth talking to your OB provider about CMV testing, and in particular for your baby. But it may not be recommended that you get testing for your antibody status for CMV unless there's a concern that you may have become exposed or may have been infected in pregnancy.
I think one of the most complicated things about antibody testing for moms is that it can tell you if you've ever had an infection, but we really don't know how soon or recent that infection was. And we can ballpark it, but it really is a big difference if that infection was 6 weeks ago or 6 months ago. And sometimes that's hard to tell. So it's difficult to interpret those results. And I think naturally, when you're pregnant, or just, as a parent in general, you want to do everything for your baby. And it's natural, I think, to kind of panic a little bit or be, think your baby's at risk. So the majority of women with CMV who catch CMV or have a reactivation even during pregnancy in general do not pass it on to the fetus. And even if they do, the majority of those babies turn out just fine. So it's, I think, a really natural reaction to be worried. And of course, it's in one's right to be worried, but the odds are in your favor. So I think that's one of the reasons why we don't test everybody for antibodies, but it is really important to talk to your doctor about your own particular risks. But it's also important to know that most babies do just fine. I think that's why we recommend people talk to their doctors because obviously it's not one size fits all, and any of these tests are not easy to interpret. There can also be prenatal testing for the baby or the fetus before it's been born. And usually this is when there's a finding, say, on ultrasound, and, perhaps they think, oh, could that be a brain abnormality or a spot on the bowel that could be associated with CMV? So in those situations where the suspicion for CMV is quite high, your OBGYN may recommend a amniocentesis, which is done under ultrasound. And it's a small needle or little straw that is inserted through the abdomen into the amniotic fluid in the uterus. And just a little bit of fluid is withdrawn from around the placenta. And then they test that for CMV. That is not done unless there is a high suspicion. But the takeaway here is that it's going to be important to have these conversations with your doctor because, this is so personal and it's going to be different for everyone.
Right, I totally agree. We're learning more and more about CMV every day. And so it is important to, as you go through your pregnancies, to first of all be aware of CMV and be aware of the ways you can reduce your chance to come in contact with it during pregnancy by washing your hands, wearing gloves when you change a diaper, things like that. But also to be talking to your doctor to form that partnership with your doctor around your CMV risk, being the most common congenital infection. All pregnant women should be thinking about the ways that they can be reducing their chance of coming in contact with CMV during pregnancy, and also what needs to be done in terms of testing, in particular, testing your babies as they're growing up. What screening is needed to make sure that they're hearing correctly, their learning is staying on track, and whether they would benefit from any therapy at all. So don't be afraid to ask questions, is the most important message today.
Absolutely. And if your baby does test positive for congenital CMV, there are a lot of supports out there. Even compared to 10 years ago, we know so much more about the virus and what to look out for so we can get kids supports sooner rather than later if they need them to kind of prevent or minimize any sort of developmental delays. And when I say supports, I mean things like help with their hearing, physical therapy if they need it. Hearing loss is the most common kind of long-term effect of congenital CMV. Probably happens in about 20% of babies. And it can happen when they're born, but also can develop over childhood, which is why we watch it super closely. But hearing loss is not the only thing that can be caused by congenital CMV. My daughter, she's 4 now. She's deaf and she has cochlear implants on both sides. So she does have some access to sound. But she, like some kids with CMV, has had delays in, walking and, of course, talking. And she's an absolute joy. And sometimes I joke that she looks bad on paper, but in person, she's just an amazing kid. So there's lots of things for parents to be aware of. And it's good to have our eyes open, but also know that 3/4 of these kids are just going to have no negative effects of the CMV virus at all.
I love hearing stories about your daughter and all that she's achieving as she grows up. The point is that there are things that we can do to develop the best outcomes for children that do get the infection, and also to work towards prevention as well as testing to make sure that we're all go in with eyes wide open, knowing what our kids are going to need for their best future. And also, we can educate others that are going through pregnancy and have new children, have children in daycare, and you might see them washing off the pacifier in their own mouth, which is one of my biggest pet peeves. Don't do that. So, there are a lot of ways that we can all band together here.
I completely agree. And I think a lot of reasons to have a ton of hope for the future. Dr. Permar, I know we're getting short on time. I could talk to you all day. Thank you so much for joining me today. This was really great.
Thank you for having me. And yes, I'll talk CMV with you anytime.
Amazing. And thank you to everyone who tuned in today.